While Dad was in hospital, the amount of times I said to people, I wish that the left hand knew what the right hand was doing, because I was totally confused. I was absolutely confused with what people knew and what people didn't know.
The MDTs are the multidisciplinary team meetings, and the patients that we choose generally are the more complex patients that have complex needs that are not necessarily met by a GP alone looking at the patients. You'd need the wider primary extended care team.
The value of multidisciplinary team meetings is really, really great. The fact that all professionals can come together to discuss highly complex cases for each and every professional to identify their role and see how to help and move the cases forward, it's very important.
That's what the MDT can do. If these patients know that their cases are being discussed, they feel that they count. They're not just a name on a list. They're people that other people are caring about and want the best for.
I think it's quite useful to work health and social care together because it's integrated now, and we can share the information so that we are not duplicating the same information again and again, and also it is time efficiency. When the referral comes, we quickly pick on the referrals and meet the client's needs and work as a team as a health and social care.
I think the value of the MDT really is that we're so many different healthcare professionals, and we all work in different areas. We all have very different skills, different experience, and we can all help each other.
I think the MDT provides a good platform to discuss holistic needs because you're looking at the patient from all different angles. So it's not just the medical side, it's not just the social side. It's like putting it all together to provide a package of care.
My role is to coordinate and liaise with practices, GPs, London Borough of Newham, CCG, all sorts of admin staffs and communities involved in making sure MDT meetings go the way they should.
We're very much more aware of what's going on in the community. A lot of the time as a GP, all I see is the medical side of things when patients come in to see me. So now I get feedback from the social workers and different members of the team. So I really feel that that helps with integrating care.
I'd say that the MDT meetings are making me more confident in my service and my own profession and the care that I can give to people, because I know that if I come across a problem, I can bring it up at the MDT meeting.
Yeah, I think a lot of our patients just need that human touch, not going to hospital all the time. Yes, so the difference is there, and I think it has helped prevent frequent hospital admissions.
Having one point of contact will be much easier for me. I'm really, really happy with this, and Dad seems to be getting better, and my life seems to be improving.
The value of the social care with the MDT meeting is because it's able to discuss and to work as a team. It's very beneficial for the patient because if it's only one team that is visiting, seeing the patient, you'll not be able to really overall holistic assessment for the patient.
My role acts as that link between the team, the MDT team, and the patient. So essentially it's about making sure that decisions are coordinated and managed and focused on the patient, but also making sure that whatever decisions or actions that have been agreed are fed back to the patients and the carers.
Being able to learn from one another, so that's another thing that I think is really great. Using each other's resources and professional input.
Firstly, it has reduced the number of calls we have from patients or their carers, because once the team has been set in motion, they do know where to call, specifically instead of everything going to the GP as it used to be.
The MDT, I believe, also gives an opportunity to understand the dynamics of each individual roles, their constraints, their limitations. So you don't get frustrated when, for instance, I'm expecting social services to do something and it's not happening, because there's a better understanding of what they can, what they cannot do, and that kind of reduces conflict. Patients get that sense of everybody is talking, everybody is together, everybody is agreed. There's a consent, there's a plan as to how I'm going to be looked after. And I feel for patients that's reassuring, just knowing that it's all coordinated and it's coordinated around them.
I think it's important because when we're looking at patients, it's not just about their medical needs, it is about their holistic needs. So there's a lot of social, psychological, as well as their clinical needs, and it all has to be considered together. You can't separate those things.